This is a healthcare cost estimator tool, as well as an HSA modeling tool to help people think about the sort of the combined world of health and wealth, especially over time. So for a typical 40-year-old male on a plan that you would see offered at an employer or purchased in an individual marketplace, kind of a middle of the road, we call a gold medal of a plan, you would expect between $1,600 and $3,500 in costs for over 3 years. So the bulk of what they're paying is in premium. The out-of-pocket costs are relatively mild, and that's what you see here. Now, the case for a high deductible health plan is one, the costs here are relatively low, and two, you get a triple tax savings for HSAs. So assuming you take the $71 and double it to say, let's spend half of it for what the cost that you need and invest half of it, you can change these assumptions. If you take that investment and you increase it 3%, you assume a 7% in HSA return on investments, which could be managed in one of these HSA accounts, and you have 25 years to retirement, then this is what your account value would be over time. So between $75,000 and $100,000, and then this is the total deposit. So you can see the effect of the compounding of this. Now, if you were to change this to say a 25-year-old, you'd see you have more years to retirement, more of a runway to grow. You can see that there's a strong correlation by age and gender. So females have higher utilization, especially in the 25 to 45 year range because of childbirth. But this enables one to be kind of customizable to a client's needs and kind of drive home the message of costs are relatively mild. You can take that, you can model it, put it in the HSA and invest it over time, and then that's kind of a bucket of cash. And again, triple tax savings over time that you could then use to pay for those more consistent out-of-pocket costs in retirement. Because when you're young, the costs are relatively low, but when you hit 65, then you're able to get into Medicare, and then there's lots you can do there. But I think this kind of shows the Venn diagram of this is low, what can you do with the money, and then how that can grow over time, which I think could be a powerful tool to kind of open the door for new conversations with financial planning clients, for them to think about this, because much of what happens in healthcare is kind of on a year basis. Plans are reset in a year. People think about yearly enrollment, but when you think about it, when you break it down over a 3-year period and kind of further break it down into what that means on a monthly basis, it becomes much more modest, and there's solutions where you can invest over time. So that's it.